Hi, this is Dr. Epstien. I'm with a patient who's been kind enough to let me show how I draw out a combination blepharoplasty, upper blepharoplasty with eyebrow transplant. We actually discussed with her the pros and cons of doing them together, and she's a great candidate. There's really very little cons other than the fact that there's a little more bruising associated with the two together, but that's really the only downside. It's done under oral sedation. She's already been given a bath, so she's nice and relaxed. But let's go to her, and let me just show what we've done for her. Let's first talk about the eyelids. Shut your eyes for me if you would. And basically what I'm doing with the upper eyelids is this excess skin is getting removed. I'll probably do a little bit of fat removal centrally, because when I push down, she's got that little bulge. You can see that little fat pocket inside. But basically the incision's made right along the upper lid crease, and I'm able to remove this excess skin. Let's go to the eyebrows, because this is a really something important to point out. When a patient has her upper eyelids done, first of all, most patients have an asymmetry. In her case, she does have an asymmetry. Open your eyes again. She's a little droopy, but this lid is droopier than the left. So in addition to taking off a tad more skin on this side, her eyebrow tends to get pulled up a little more. So I had to adjust it in terms of where her natural eyebrows were, as well as where she wants the eyebrows to be. And I've been able to achieve nice symmetry. The eyebrows are around 6 centimeters long, which is relatively typical. Somewhere between, if you're going to do anatomical markings, the corner of the nose, the lateral canthus, end of the eyebrow. So I've gone a little bit further on this on the sides, just a touch to give them a little more elegant look. You can see where the arch is peaked at around 3.8 centimeters. I do this on both sides. I don't use stencils on these procedures. I like to draw everything freehand. This way I can make adjustments. I feel that there almost always are asymmetries, so by being able to draw them freehand and then checking it out with certain measurements to assure a symmetry, I'm able to achieve the most aesthetic look. The procedure itself typically takes, in someone like this case, with the combined upper eyelids or blepharoplasty with the eyebrow transplant, it's going to take around 6 hours. First we'll do the eyelids. Actually the very first step is remove the donor hairs, then we'll do the eyelids, suture those closed, and then the eyebrows get done, and then the grafts will get planted. Anyway, this is Dr. Epstein with a very nice patient. He's here to show me how to do a combined eyelid, upper eyelid blepharoplasty with eyebrow transplant. Thank you.